Hi, everybody in YouTube land. It's Dr. Christine Anderson, or Dr. Chris, as my patients call me. So it is Tuesday. It is 6:30 here in Los Angeles, which is where I'm based. I am a chiropractor. I also have a specialty in pediatrics and functional neurology. I do integrative care. I do craniosacral therapy, nutrition, organizing lab testing. I do exercises, and I do things like my abdominal massage, biofeedback, neurofeedback. I mean, the list goes on and on and on. So I've got a lot of stuff to talk about tonight, so I don't want to talk too much about me. If you're out there and you want to say hi or you want to ask me a question, just go right for it. I'm going to get started on the hip because it is one of the largest joints in the body. It's the strongest. And there's a lot of us who have hip issues. And especially it tends to hit, I think, more active people. So it's basically due to kind of a few issues that we're going to talk about. So hopefully you can hear me. If you can't, I've just started using a microphone, so I think I see it playing on here, but I'm sure I will hear from people if it is not. So yeah, I've got the mic on, so this should be fine. All right, let's talk a little bit about the hip anatomy, and hopefully this will not give me too much trouble. All right, so with the hip anatomy, you can see my highlight in there. Let me just move that a bit. We've got the femoral head, and we've got an acetabulum there. Okay, those are the two main bony structures. That's the ball, and that's the socket. All right, then that socket part is created by the bones of the innominate or pelvis. So there's actually 3 bones in that, but it sits in the innominate bone. And it's held together by a capsule and ligaments. So it has a lot of motion, not as much as the shoulder that we talked about, which has really got a lot, but we have a lot of motion in our hip, but it is limited because of that capsule. And some people have more flexibility than others based on what's going on with the ligaments and the capsules. So we've got lots of motion based on our hip flexors. That's going to bring the leg forward. We've got our hamstrings and our glutes moving the leg back. We've got our adductors, which bring our leg to the center, and our abductors, which bring our leg away. And those muscles are all sort of involved as we rotate our hip. Okay, so we've got lots of motion there, but not as much as the shoulder. All right, let's just dive right into what can go wrong. So one of the primary things that we see is osteoarthritis. And osteo meaning bone, arthritis meaning inflammation of the joint. And this is a term that's often used. People will just say, I have arthritis. Well, what they really are saying, they have osteoarthritis, because there's other types of arthritises, but we're going to sort of stick with this one today. This is the one we think about with wear and tear and overuse issues. And people will even say, it's the arthritis of old age, which I don't ascribe to, because people of the same age don't have all the same problems, right? So we have to look at everybody as an individual. But basically, inflammation occurs. That's the itis. And it occurs as there's injury to the joint, maybe the cartilage tissue, because the cartilage lines the joint. Cartilage makes joints slippery, so that as you've got your ball and you've got your socket and you're moving your hip in that, it glides over each other, sort of like an ice skater, right? It's gliding. If you've got, a rough patch there, it's going to cause it not to move so great. And that is where you start getting this breakdown of tissue, and then you get the swelling and the pain. Maybe it starts to create deformities in the bone. A lot of things can happen. So this is part of the thing with taking care of our joints, is we want to support the tissue, and we want to support alignment, which I will talk about. And we want to make sure that we're using proper motion with that. So a lot of stuff kind of comes with this. So people who might have osteoarthritis might have like joint stiffness as they are getting out of bed or after they're sitting for a while and they go to get up and it's like, oi, if I'm sitting in the car too long, ugh. If you see any swelling or redness or tenderness of a joint, definitely it's usually occurring with pain. Now, in the case of the hip, sometimes you might hear a crunching sound or a popping sound of where those bones are rubbing against each other, or sometimes it's against the tendons in that area. So we can't just assume it's the joint. And then you might have a little bit of a loss of range of motion. Let's just say you're trying to take your foot onto your ankle to sort of put socks on or lift your knee up, and it's not happening because that motion just isn't working for you. So we don't really know everything that goes into osteoarthritis, but we know a few factors that might be a risk factor. So one of the things, and this goes back to my work as a pediatric chiropractor, is those joints might not have formed properly. There's something called congenital hip dysplasia. It has other names, and I'll talk about that in a bit. And there's also something called Legg-Calve-Perthe Disease or syndrome or disorder. And these are things that occur early on in life, and they disrupt how that ball fits into the socket. So I'm going to go into that a little bit more in a second. So let's talk about some of these other causative factors. The person who's putting extra stress on their joints. This could be someone who's overweight. And especially if you're overweight and then you're trying to do high impact activities, I do see a lot of people who have too much weight on them and then they're trying to run. That's a lot of stress on the joints. So we have to be careful about doing appropriate exercise for what our bodies can handle for, what we want them to do without injuring. So it's that balance, right? Now, sometimes there's issues with the cartilage that might be caused by genetic factors, but I'm not really going to stress that. I'm going to talk about things we can actually work on. So the main goal when I'm looking at someone with osteoarthritis of the hip is to help mitigate the pain and increase their mobility. And by doing that, it's not just about, we want to get rid of the pain at all costs, but by increasing the mobility and maybe the nutrition of the joint and looking at lifestyle and modifications, that person's going to have better alignment, better movement, less irritation, less inflammation, better function. So this could mean initially maybe resting the joint, right? Don't use the hip. And this, I definitely have experienced this where I had to basically stop hiking and walking for a while when I had a hip flare up. Again, that's going to be like the last thing I talk about is my hip experiences. Sometimes people might need to use assistance like a cane or a walker, just so that they're not putting stress on other parts of their body. Definitely losing weight. All right. Anytime you can lose weight, that means you're going to take stress off your entire system. We want to exercise the muscles, strengthen them around the joints. We want to move that joint as much as possible in the range of motion properly to prevent wear and tear. And this is one of the reasons I really recommend you subscribe to this channel, is because I do this weekly show, but then I will put some more videos on. I'm trying to every single week at least add one or two where I'm looking at these exercises. So I specifically will be putting exercises on here for strengthening the hips and flexibility of the hips and some restorative exercises for different hip conditions. So I really recommend you subscribe, and then you will know when I post a video. Of course, I want to look at complementary and alternative therapies because this is my world, right? We don't want to necessarily wait until we get to a point where there's so much destruction from arthritis that the only option is surgery. So, of course, with chiropractic, I'm looking at alignment of the pelvic bones, of how the hips are actually moving in that ball and socket. I can adjust the hips. I can adjust the knees, the feet, everything in that kinetic chain that I talk about, because everything is linked to the other thing. So if somebody has a hip issue, I'm checking their pelvis, I'm checking their sacrum, I'm checking low back, the feet, the knees, everything in that kinetic chain. Maybe acupuncture might be helpful with mitigating some of the pain. Not my area of specialty, but sometimes if you have an issue, you need to treat it at different levels to help support the overall body. And then there's other things that I might talk about, like stem cell therapies or platelet therapies, PRP. And then there's another treatment called shockwave therapy. And this is something I've actually been using myself. Again, I'm going to talk more about that. Now, sometimes when there's so much degeneration, people do have to have surgery and they do a hip replacement or sometimes a resurfacing of the cartilage. Now, in my family, my mother actually has had hip replacements and she's had multiple ones. This last time she had her hip replaced was a really bad one because it actually broke and displaced and was so deformed. So she had to have like a rod put in and a whole bunch of other things. So this is very motivating for me because I am surgery phobic. I'm just going to admit it right here. Okay. It scares the bejesus out of me that I would be gone under a knife. Somebody would be cutting into me. So I am doing everything I possibly can to help support my hips because I do not want to have to ever consider having surgery. And that's me. There are some people that's what they want to do, but personally, this is kind of how I live my life. I'm like, yes, we have a motivation towards something. Well, this is so I don't have to have surgery, hopefully ever. All right, so let's talk about some of these other risk factors that occur early on in life. So if you have young children or you're having a baby, these are some things to consider. Now, this one called congenital hip dysplasia or developmental hip dysplasia, or sometimes you'll hear it called congenital hip dislocation even, is what happens is this ball and socket does not form properly in babies when they are developing in utero, in mom's tummy, okay? Now, when you look at these babies' bones on x-ray, you don't see full bones like you do with adults. They're in pieces, and this is because these are little islands of bone that will continue to grow. So it's funny because you just see it's almost like a little pea-sized bone in the shape of the hip joint, but that bone is there. It's just in cartilage form, and then that bone deposits in the cartilage. It's a really cool system that we've developed, and this is in the long bones of the body. It's a little bit different in the skull and and the vertebra and some of the other bones, but in the long bones, we have these what are called epiphyseal plates, little bone islands that grow, and then when we hit a certain age, they stop. Pretty incredible. Anyway, so what happens is we have our socket, we have our acetabulum, and instead of the bone being here, it might displace here. So it starts to deform itself. And therefore, if you have a change in structure, you're going to have a change in function. So there's a couple of things that might contribute to this. It might be low amniotic fluid in the womb. It might be a breech presentation where babies are head up instead of head down, and they get into like a little froggy position. So their feet are sometimes up and instead of being tucked in. So that starts to change how those leg bones are fitting into that socket. This is another reason why chiropractic in pregnancy can help with the development of the baby. And this has to go with the space involved for that baby to get in a comfortable head down position, which can affect not only the birth, but also the development of the baby's structure, as we're seeing, and their neurologic development. So this is really quite a common thing. And I certainly do take a history when babies come in. And if they have a history of a breech birth, then I look anyway, but I'm definitely going to look for these dislocations or this displacement. So if your baby is, you're looking at them and maybe one leg looks a little shorter, or maybe one leg is turned outward, and then you're looking at their little cute little folds in their legs, and you might see unequal folds either in the legs or in the little butt curve. Maybe there's a clunking sound when their hips are rotated, or it's hard to move their legs. This is something that you might consider. And there's a little bit of controversy about this, but typically an ultrasound, pardon me, will be done if this is suspected. There's some controversy about that, but that's sort of the diagnostic equipment of choice. Usually infants are put in something called a Pavlik harness. It keeps the legs more like in a frog leg position. So it tries to help hold that ball in the socket so it can start forming properly. And that typically will go on for about 6 to 12 weeks. And if things are moving better, then there may be no other treatment necessary. And this is where, again, chiropractic can help with these babies to make sure all that alignment is happening so that they have a best chance of that, the ball of the bone fitting better in the socket, right? So it's about alignment. All right. In terms of prognosis, the earlier that this is found and treated with babies, then almost always they have normal development of the hips. If you catch it later, it decreases. So you want to really make sure that this is taken care of early on. Occasionally, they go in and do some surgery, but typically caught early, great prognosis. So that's good enough to hear. All right, just really quickly about this other condition called Legg-Calve-Perthe. And this is a condition that occurs a little bit later on in life. This is usually around like 4 to 10 years old, with the average about 6 years old. And what happens is that, and we don't really know the reason, but for some reason, the blood supply to the head of this bone gets cut off. And so it stops growing and developing. It doesn't have any nutrition. It can't build up the bone how it's supposed to. And so that bone is going to start dying if it's not fed nutrition, right? So that weakens and it loses its shape, and it actually becomes a little bit flatter because it's not molding to that socket. So with these kids, if you do have a child and you notice they're limping, or they have pain or stiffness in the hip, the groin, the thigh, the knee, anywhere in that chain, they have limited range of motion of the hip, and it's pain that worsens with activity and improves with rest. Kids usually don't have joint pain. Kids usually don't have back pain. So if they do have pain anywhere, it really does need to be checked out. Don't just disregard it like, oh, they'll just grow out of it. To me, it's a red flag that something is going on. It could just be they're out of alignment, but what if it's something like this? So as I said, it's occurring mostly between 4 and 10. It's 4 times more common in boys than girls, and it generally occurs more in the white population than other populations. So I don't know why again, but if this is addressed early on, those who are develop this and treated and diagnosed before the age of 6, then they are less likely to have problems later on. After 6-year-old, they're more likely to develop problems in adulthood, including things like osteoarthritis. So there we go. All right, so let's go back to a couple of other issues before we wrap it up. There's also a condition called trochanteric, or there might be something called Iliopsoas Bursitis. Basically, bursitis, a bursa is a liquid-filled sac, and it's usually like a cushion between bone and a tendon, or bone and a muscle. So it acts like a little cushion, and when that gets inflamed, then you might have rubbing of tissues and inflammation, right? So that's going to cause pain. It's kind of like when you get a blister on your heel, right? Because it's been rubbing against your shoe. Well, same here. It's like a blister inside your body. So the trochanter is on the outer part of your hip. Let me see if I can get this picture up, because of course it went away here. So here we have showing the bursa. This is the trochanter. It's that side bony bit there. And in blue, they're showing the bursa, showing how there's a little fluid-filled sac between that ligament there. All right. So this can become inflamed if you overuse your hip or injure your hip. It's pretty common. It generally occurs in middle-aged or older people, but it's usually in active people who are regularly walking, running, cycling. And in that area is the IT band, or iliotibial band. This is tough connective tissue that can get tight and inflamed. This is what I often talk about when I say to foam roll. So I'm going to have to put some foam rolling videos up, especially for the hip, because you can get in there and massage it. You can lay on a tennis ball, but you don't want to do it so much that you inflame it more. So while it's really active, you want to first maybe ice it, rest it, and then to take care of it in the long term, you want to do things to keep that area from getting too tight. So one of the best things you can do for this is to watch your posture, because any poor posture is going to put stress and tension on your hips in an unequal way, and that's when you'll get this bursitis, either of the trochanter or the hip flexor, which is that, I don't have a picture of it here, but it goes from the front part of the spine, crosses the pelvis, and attaches onto the hip here. And it's the thing that when you bring your knee up, that's what you're using as your hip flexor. And it often gets tight in us as modern day people because we sit and then we sit some more. We sit for work, we sit in our cars, we sit on our couches. So this is often a tight area. I have my hip flexor stretching video, so you can check that out and watch it. And I will put links to all of that in the description. So we want to make sure we're stretching. We want to make sure that we are warming up, listening to our body. Maybe orthotics might be helpful, and I will do a video just on orthotics, probably when I talk about feet in a few weeks. And of course, regular chiropractic care. I mean, that's the mantra, right? So you can ice your bursa if it is irritated. You can rest it. You can use that shock therapy I was talking about. You can use specific exercises, and I also love to use essential oils for muscles and joints and ligaments, and I'll put a description to that too. Wow. A few more things to talk about. Tendinitis in general. Tendons are the things that attach our muscle to the bones, and they can become inflamed if you are doing repetitive things over and over. So I'm thinking like CrossFit, where you're doing the same thing over and over and over and over, or if you're just a runner and you don't do any cross exercising, you might want to rethink your exercise program and look at what you can do to maximize the use of all the muscles in your body and not just use one set of muscles, because that is going to create a chance for you to become injured or inflamed. And then you have to lay off it, right? So we don't want to stop. All right. In general, subluxation, we can have misalignment of our pelvis and our hips. So it could just be that. And this is what I'm checking out when patients come in. What exactly is going on with their hips? Hip pain just is the beginning of the story. All right, now I get to talk about me and my history and story with hip impingement. Well, a couple of years ago, I think it's going to be like 3.5 now. Oh my gosh. All of a sudden, I would bend forward and my hips would lock up, especially my left side, sometimes my right. So I would be bent over my hips would be locked up and I would have to wait for them to unhinge before I could stand up. And there was nothing I could do. There was no like stretching out of it or whatnot. I just would be like, ow, 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 ow. And I would have to just wait for it to basically unhinge itself. And this became very problematic, especially when I was doing aerial tricks and 20 feet up in the air, and I would go into a flex position and my hips would lock up. It was very painful to walk. It was painful to sit. I would sit and then get up and like my hip would want to collapse out under me. It was not a good time. So this hip impingement is also called femoroacetabular impingement. What does that mean? It means the femoral head gets stuck in the acetabulum. And so it gets stuck in position and then it just has to kind of release itself. It is not fun. And it's basically a result of increased friction during hip movements that start to damage the joint integrity and degenerate it. And then it creates bone spurs that kind of make the joint unstable, and it definitely limits range of motion. So right now, I cannot completely bring my knee to my chest because of what is going on with my hips. I have better motion now after working with it, but I still cannot completely do that motion. I can go down now into flexion, so bend forward, without it locking up, pretty much. Occasionally, I'll feel it start and I can stop myself before it goes into full lockdown. So it is so much better. But let me just show you an example of this so you kind of know a little bit more what I'm talking about. Here's the hip joint. So there's different types. This is a type of impingement of the acetabulum. Here's a type of impingement of the femoral head. And here's a combined one, which is really common to have that mixed impingement. And I do think that I have this because it's not only when I bring my knee up to my chest or bend forward, but if I bring my leg across my body too, it sometimes irritates. So there's stiffness, there's pain, there might be a popping or clicking sound. So this does limit some things that I do in aerial class, like bringing my leg just up and down straight in front of me is a no-no right now. I have to actually bend my knee and then straighten it. So I've just made accommodations because I don't want to keep irritating my hip and creating more of a problem so it degenerates more. So I would rather make accommodations for my hip for where it is at the moment, keep active, and then, possibly over time, it's going to heal. So this can show up in athletes, and it is usually people who are active that this is occurring in. It's a wide range of sports from soccer, football, tennis, golf, and also dance or aerial type of dance. On the opposite end of the spectrum, sitting too much can also play a role in this. So too much flexion. And I actually think this is something that kind of tipped me over the edge with this as well, because I was thinking about what I do in my life. And for 30 years, I've been standing up and bending forward and leaning over patients day after day after day. So I think that was the start of it. And then with my aerial arts, there were a couple of instances that I can tell added to that. And then that straw just said, that's it. The camel's back is gone, or in my case, my hips. And it sent me some messages that you have to do something about this. I was also doing high impact aerobics and low impact aerobics, which I have stopped for the moment. I stopped hiking. Now I'm back to walking on the flat, which is really great. So I'm slowly regaining the function of things that I just sort of backed off a lot of. There are tons of journal articles out there talking about this, especially in relation to treatments. So there's the surgical treatment and there's non-surgical treatment. And basically, what I could see when I was studying, as I was looking at this, especially in relation to me, it's really not good news out there for having surgery for this type of condition. Oftentimes, there is more osteoarthritis afterwards, and oftentimes the pain isn't less and the problem doesn't go away. So I prefer to look at this and look at my body and look where there were imbalances. So I stopped doing all the front core exercises and I really started focusing on my back core to help my hips with that balance. And I don't put them through ranges of motion that are going to stress them too much. Along with that, I am continuing doing my stretching. I'm continuing doing hip strengthening exercises. And I started off with shockwave therapy like every 5 days or so, and now it's every 3 weeks. So I still do get the therapy, but it's much, much less. Woo! I got it all out. So again, we have to sort of differentiate that from a hip flexor strain. And when I do a video, I'm going to actually show you a test you can do to find out if maybe hip impingement is your problem. All right, everybody. If you're out there and you've got a question, now is your time to ask. If not, I'm going to wrap this up. If you like what I have to say, if you liked my content, not necessarily the bad news, but the content, give me a thumbs up. Please share this with your friends. Please subscribe to my channel so you know when I post new videos. Have a great week, and next week I will see you when we talk about optimal knee health. Bye.